All right, so the lab part of the root canals. Okay, we're just basically going to go over instrumentations or the instruments that are used. Root canals, if you talk to most assistants, they're boring for an assistant. Again, there's not much you're doing other than setting files and not much suction, and you're suctioning whenever the dentist. But usually the dentist is just in there with a file working inside the tooth. So if it's isolated with a rubber dam, I mean, you don't even have to be suctioning until he's going to irrigate. So again, it's kind of not much excitement as a dental assistant. Unless you need to take an x-ray, then that's your time to shine, because you need to get a good x-ray. Okay, so endodontic instruments, an extra S right there. Fabricated from stainless steel and nickel titanium alloy wire. Okay, this wire is twisted into instruments called files and reamers. So know that they're made out of stainless steel and nickel. That's on the test. And titanium. The nickel titanium, when those came out, the hand files, those were good because they didn't break as easy. The stainless steel, you can pre-bend them. If you have a canal that's curved, you can get your file and kind of pre-bend it so that it follows the canal. The titanium, if you bend it, it bounces back. You bend it, it bounces back. But the good thing is that it doesn't break as easy. They still break, but not as easy. So all the rotary ones, after titanium files came out, all the rotary instruments, they're nickel titanium because they bend really easy on the inside the canals. Okay, so the properties of intracanal instruments: one, they're flexible. You've got to have something that bends and follows the curve of the root. Fracture resistant to a point. They still fracture, but that's what you want. You want it as fracture resistant to a point, and again, the nickel titanium are the ones that are the most resistant. You want them smooth. You want able to maintain sharp cutting edges. They shouldn't corrode when you sterilize them. Okay, so the files, stainless steel or nickel titanium. Barbed brooches, I showed you a picture. Again, it's just a file with hooks on it. Okay, it looks like that when you blow it up. It's got little hooks, and you go like that to your glove, and it'll catch your glove. So you gotta be careful, especially if it's been used, because it'll poke you. So these usually, if they're used, usually they're thrown out, especially if you get a lot of debris on them. You can try cleaning them with alcohol, ultrasonic, but usually if it gets a lot of pulp tissue, they're hard to clean, so we just pinch them. But make sure you check with the office where you're at, because they may put them in an ultrasonic and clean them, and you could reuse them. Reamers, again, it's just a twisted file. Rubber stops, I talked about. Gates Glidden drills, I'll show you a picture. It's just a reamer. Okay, so here's again, rubber stoppers, and you use them to set the length that you establish for either one canal, two canals, or three. I mean, sometimes you can have 4 canals in a tooth. And say the mesiobuccal canal is 18, the mesiolingual canal is 17, the distal buccal is whatever, 22, and the distal lingual could be 21. And you have to keep track of all those numbers, because if he says, let me a file for the mesiolingual, and you'll write it down. The mesiolingual was 21, and you'll set it. Give me a file for the mesiobuccal. Mesiobuccal was whatever, and you set it. So you need to have a pen or a pencil there, and you just write it on your tray cover or whatever you have there. Just make a number. Put MB, mesiobuccal, P for palatal, ML for mesiolingual canal, and you're going to get a number there. Okay, these are the Gates Glidden drills. It's just a real short file, and these we use to open the orifice of the canal. Once you find the canal with the Explorer, you get your Gates Glidden drill and just kind of open the top so that you can easily get these files through. So Gates Glidden is just like a real sharp. Now these don't bend, so these you can't go into the canal very far because they'll snap. Those are not good to go too far down. That's why it's just a short file. Piezo reamers kind of looks like this one. Okay, but pay attention to the difference. Okay, here's a Gates Glidden. You can see you've got files just about, maybe a millimeter or so. The piezo reamer is the same. Basically, you're straightening out the canal. You reduce the curvature of the canal up on top. I'll show you a picture. Spirals, we use this to spin a sealer down to the bottom. When we're cementing a post or when we're cementing something, it's like if you look at a barber pole when it's spinning, you can see that it's like moving up. That's what these spirals look like. And you put it and you turn it on and it just goes. Your eyes just kind of go up and up because it's the way it's spinning. So it's these guys. This is the reamer, and you can see the reamer, piezo reamer, is a little different than the Gates Glidden. It's got maybe 3 millimeters instead of 1, and you're just straightening out the top part of the canal. So they may use these. If they do a lot of root canals, you need to know the difference between a piezo reamer and a Gates Glidden drill because they look alike. You can see these guys have little hashes right here. This is 1, 2, 3, 4, 5, and 6. If they say, let me have a number 6 piezo reamer, you gotta find one that has 6 hashes. Okay, and the Gates Glidden have the same thing. They have 1, 2, 3. Again, you can see that it's just the diameter. They're just getting fatter and fatter. Okay, just depends on what they need. You can't put this on a mesiobuccal canal of a molar, but you could probably put it on the palatal canal and the distal canal of the lowers, just because those canals are usually bigger. These are you're going to use on the smaller canals. And again, if you imagine this spinning, you can see that this looks like it'll just be spinning up. So you put cement or sealer on that, and you turn on your handpiece, and it'll spin it up to the top of the canal. Files, again, they're enlarged and smooth the canal. These instruments are tapered and twisted instruments that are moved in and up and down motion with the canal. Okay, so the types of files, there's K files, and you really don't need to know this, just know that the files is what you use to shape and widen the canal. But there's K files and there's headstrom files. And it's just the way these guys are bent, okay? Just how tight they're bent. If it's a triangle piece of metal spun, or if it's a square piece of metal spun. Again, in the headstrom files, the main difference is that you go in, you just go in, out. You don't twist. These guys, you go in, twist, pull, in, twist, pull. So it's just the way they're used, but they're both files, just depends on what you need. Okay, the instruments that you'll see right now, you need an endodontic spoon excavator, and it looks just like the ones that we use for doing an MOD amalgam. Okay, it looks just like it, except it's what? Longer. Because if you can imagine, you've got your access hole, you've got to get that spoon down, way down to the bottom. Okay, so it's a regular spoon, depends on the size that they prefer, but it's just longer from here to here, the shank here. This is all the same, this is just longer for you to get inside the tooth and remove the pulp. Okay, Endodontic Explorer. Okay, it's just like a, well, not just like it, but it does the same thing. Basically, we use this to find the opening of the canal. So once you remove the pulp, you find the floor of the chamber, and sometimes it's not bleeding, and you start to poke around. Start to poke on the floor until you feel something soft. These are really sharp. You feel something soft, and you just push and try to see if that's where the opening is. Okay, so that's just an Explorer, and it's double-ended usually, one on each side. It's just got a little different angle. Now it looks a lot like this, which is a spreader. Okay, the spreader only has one side. Okay, and this is, if you're not using the hot gutta percha technique, you're using it's called lateral condensation. When you put multiple pieces of gutta percha, and then you put your spreader inside the canal and just basically put pressure and spread that gutta percha, push it out to the side and create a little hole, and you put another gutta percha and then you put the spreader, press it to the side, you put another gutta percha, and you just put as many as you can inside. And Dr. Cervantes will go over that on the, when he does the root canal. Okay, so again, this and this looks pretty similar. This is usually a little bit shorter, okay, because you don't use this to go into the canals. You just use it to find the canal. You just find the opening. And once you find it in your filling, then you're going to use your spreader, because this, you just bury it into the canal. You go in the canal and spread. Now pluggers, they're different, but you can see these are in 3 mil, kind of like a perioprobe. But it looks like a little hammer again, like a condenser. And again, these are 3 millimeters. And these, sometimes we heat it after we put the gutta percha in there. You heat this, and if you need a certain amount of space for a post or to put a composite or something, you know how deep you're going. You heat it and you go into the gutta percha and burn it out, melt it and burn it out. Okay, that's why this is measured. Okay, this is an instrument you need to know, the glick. And it looks like a little beaver tail, and then it's got a condenser or a plugger on the other side. Okay, and this is an instrument you use once the root canal is, you're almost done and you verified everything. This is, you heat it up and you just burn out all the gutta percha in there. So you just heat it bright red and you just go, don't close because it's going to burn. You just sear off the gutta percha. So you make sure the patient doesn't close, because you get their lip and it's red hot. You leave them a little tattoo. Not good. Okay, materials. Again, we've covered paper points. They're just little bounty, quicker picker upper absorbent points. And again, remember these are in different sizes depending if it's a narrow canal or a coarse canal, very wide. Gutta percha is a material that we use to fill or obturate. Again, you can see these paper points and gutta percha points, they same number or same colors. Okay, the whites go with the whites, the yellows go with the yellows, and you'll see that the file, the number 8 file is gray, the number 10 file is purple, then you've got 15 is white, 20 is yellow, 25 is red, 30 is green, 35 is yellow, green. Well, 30 is blue, 35 is green, and then 40 is black, and then it goes back. 45 is white again. So again, the colors will match. Irrigation solution, again, we talked about, is bleach, high sodium hypochlorite. The sealer is a cement. You're just trying to get a good seal at the end of the root. And again, if you're going out the end of the root, it's just making it tougher and tougher for that sealer to plug up the end. Okay, there can be different sealers. This is like a resin. We used to have that. Now, I think we've got Thermoseal now because we're using hot gutta percha. But there's Seal-Apex, depending on what the doctor uses, there's different types of materials. And Clorox, just sodium hypochlorite. The root canal treatment, again, we're going to access the top portion of the tooth, get into the chamber. What you're going to need, again, your basic setup, endodontic explorer, cotton pliers, and for root canals, locking cotton pliers are good. Because when you're handing small instruments or paper points, and if you go to transfer it to the dentist and you open it a little bit, it's going to fall. So it's got a little clamp, and you close it and it locks, and so you can hand it and it's not going to open and drop. So for root canals, locking cotton pliers are good. Not everybody has them, and I don't think we have on our kits. We've got it on a few kits, not all of them. Again, then your normal saliva ejector, dental dam, high speed, slow speed, barred roaches, all that stuff you'll see on the setup. Okay, you're going to anesthetize, place the dam. We open the tooth up with a high speed. We remove the pulp from the chamber. find the canals. We use the files, take an x-ray or use an apex locator to verify.
We're missing a page, can we stop at 4?
Really? Alright, then you don't have to know all this. You stop at 4?
Yep.
Yeah.
Alright. Well, 5 is small endodontic file. I'll print this out for you. Small endodontic file is used to navigate the canal, and we're basically widening the canal. We verify that, rinse with sodium hypochlorite. We verify it, dry it, we put sealer, and then put the gutta percha in there, and then you take a final x-ray to verify that it looks good. Alrighty. You want to show them the root canal instruments real quick before we go on to the anesthesia?
Oh, yeah.
Alright, so Dr. Cervantes has all the endo set up right there so you guys can see the instruments.